So in today's video, I want to show you one revolutionary exercise that you can do to help with your hip impingement. Now, I'll freely admit the term revolutionary can seem a bit over the top. It can seem a little bit clickbaity for a video of this type. But as I'll explain in a second, hopefully it can be. And the reason why I wanted to make a video like this is because as someone who treats femoroacetabular impingement or hip impingement quite often, the way that we currently tend to look at hip impingement, I feel, is a little bit different than what we should. The obvious part of hip impingement is that you have the ball and the socket joint that makes up your hip, and instead of that ball and socket joint smoothly moving through all the different ranges of motion that it can, if you have a bony abnormality, then you can very easily jam up and irritate and annoy and impinge tissue within that hip. But clinically as a physiotherapist, one of the things that I don't think we consider enough with hip impingement is the role of the hip joint capsule. And for anyone unaware of what that is, if you had that ball and socket joint and we were to wrap that up in a really thick, tight plastic wrap, then that's very similar conceptually to what the hip joint capsule actually does. And thanks to the modern world that we find ourselves in, if you're someone who spends a decent amount of time sitting, that hip joint capsule can become stiffer and tighter and more restricted than it needs to. If that hip joint capsule is also stiff, tight, restricted and dysfunctional, and it decreases the ability for that hip joint to move smoothly in the way that it's potentially intended to, then that hip joint capsular stiffness may actually contribute to some of that bony abnormality that you develop that creates that hip impingement. If we aren't getting to some of that hidden underlying joint capsular restrictions, then it's essentially hard to know exactly how much of an impact that bony irregularity or that mechanical dysfunction might be having on your hip. So it goes without saying, if you can try this exercise that I'm about to show you, assess and reassess your symptoms, the symptoms that you get every day, do the things that you would normally do that annoy your hip and your groin potentially before doing this exercise, come back to them after doing the exercise and see what potential ramifications you might be having. Because based on what I've found clinically with my patients, there is a proportion of people who can avoid hip surgery by improving the space that your hip has to move. We can potentially see an improvement in how that hip joint is actually moving within the space that it's intended to, and get a better understanding of what the limiting factor might actually be. So essentially all we want to get you to do is, if we're trying to mobilize the joint on the left-hand side or the side closest to the camera, we essentially want you to be onto your hands and knees, and all we need you to do is take the opposite leg back to the one that you're trying to stretch, and from here we want to basically get you to drop down into this position a little bit more, where you take your bottom back towards your foot, essentially creating more hip flexion in this position. And from here, keeping your shoulders and your hips together, we essentially want your entire trunk to shift towards the side that you're trying to stretch and mobilize. Again, if you're doing this correctly, where your chest and your trunk is essentially parallel to the ground the whole time, you shouldn't have to move too far until you feel a gentle pressure at the side of your hip. If you feel like you're dropping all the way down into this position, you're disconnecting your hips from your trunk and you're not getting enough specific motion directly through your hip to bias the capsule and encourage it to mobilize. A great concept to think of while you're doing this exercise is, as you're coming across and potentially down trying to find where the best version of your tightness is, imagine that you're allowing your thigh bone to gently and respectfully push out the back corner of your hip. You just want to put your hip joint into a position where you feel that gentle pressure at the side, and all we want to do is just hang out here for 30 seconds or 60 seconds, giving that capsular tissue a chance to accommodate. So just hunt around up or down or a little bit further to the side to try and find the best version of that stretch for you. It's also very important to note that you should not be feeling any groin or hip impingement while doing this. If you do feel like something is impinging in your hip as you're coming across, come out of that hip flex position a little bit more, try and be more sort of 90 degrees as opposed to a deeper range, just to get out of that impinged shape and go looking for some of that capsular restriction instead. From here, what we can also do is we can bias different capsular shapes. With your legs straight back, this tends to focus on biasing more of the hip flexed related capsular restriction, but we can also try and find some of the rotational restrictions that might also be limiting your hip joint function and ultimately causing that hip to impinge. Part 2 of this stretch is with the side that you're trying to stretch. If you can externally rotate your hip so that your leg travels underneath your opposite leg, you can then block that by dropping down the opposite leg and also help push that further into that external rotated position as far as you feel comfortable. From here, the same principle applies. We're just trying to shift our body weight across to the side that we're trying to stretch and try and find some tightness. This time, it won't be at the side of your hip. You might find it's more towards the back pocket a little bit more. We just want to hang it here for 30 to 60 seconds, trying to find any capsular pressure or tightness that feels comfortable, and give this enough time to change. And again, once you've done that for 30 to 60 seconds, we can unwind you and we can then bias hip internal rotation as well. So from here, instead of taking our leg underneath, we can internally rotate our foot so it actually travels outside the line of our body, dig those toes in just to block that position. Same deal, we can come down and across as far as you feel comfortable, this time looking for a pressure or tension more towards the front of that hip joint. Again, it's still at the side, it's not in the groin, it's just a little bit further forward than what you were the first time. Again, if you do feel like you get some hip impingement in this position, then same thing as before, instead of being right down into a hip flexed bias shape, come out of that a little bit more as well. Give that hip a little bit more space to play while you're biasing that internal rotation at the same time. Same deal, hang out here for 15, 30, 60 seconds as long as you feel comfortable. And then once you've done that, you should automatically feel like there's more range of motion in that hip than what you had before. But what's really important for you is that if you have done some specific movements or some activities that would normally generate some of that hip impingement type symptoms for you, do them again immediately after this exercise and see what's changed. Because as I said earlier on in the video, if you do this exercise and it changes the symptoms that you feel straight away to some degree, then that tells us that there may be a capsular restriction component to your hip impinging. And it's really important, if that's the case, that you do yourself a favor and spend some time doing this exercise and different variations of this exercise. Ride that wave for as long as you possibly can so that you keep seeing that improvement to whatever end you can find. But again, if you haven't taken the time to explore that capsular restriction, you could be missing one of the foundational and fundamental reasons for why that hip joint is impinging in the first place. So please let me know in the comments down below what impact, if any, that hip capsular stretch had on your symptoms, just so that other people watching this video can get a sense of how important it might be for them as well. Again, it's always important to reaffirm that the capsular stretches on their own need to be part of a balanced rehab approach. And if you don't feel you're getting that from your current doctor or your physical therapist or physiotherapist, please consider booking in an online consultation with me. I'll leave a link in the description below. Another video should pop up that you can watch in a second, and I hope to see you there. Bye.